Desmurgy is the branch of surgery that regulates the principles of bandaging and its uses. Bandaging is the application of bandage material on the patient's body. It is applied on a wound or other parts of the body with medical purposes. Rebandaging is the process of changing the bandage for any medical diagnostic methods, used with purpose of favorable conditions for the healing process. Classification of bandages according to the type of material. Smooth, they may be gauze bandaged or non-gauze bandaged, rigid, splint, gypsum, starch based according to the purpose of the bandaging. Wound bandaging promotes a faster healing. They are divided into absorptive, protective, activated with medicine, non-traumatic. Fixing are indicated for fixation of bandage material on the wound. Pressurizing or hemostatic are applied to stop bleeding. Occlusive or hermetization are used in case of penetrating trauma/wound of the thorax. They prevent air infiltration into the pleural cavity from the outside. Compressive are indicated for improvement of venal blood drainage from inferior limbs. Immobilization are subdivided into transporting and medicinal. They ensure immobilization of the wounded part of the body. Bandage with traction are used for traction of any part of the body. Corrective are used for correction of incorrect position of any part of the body. Classification of soft bandages. Gauze bandages. They are either applied with the help of gauze bandages on different parts of the patient's body. Kerchief bandages. Triangular bandages are applied with the use of kerchiefs. Areas on which they are applied for immobilization of upper limbs, head, feet, hand, mammal gland and perineum. Sling bandages are applied with the use of a sling, which is a piece of a wide gauze bandage or tissue of rectangular form. Areas of use: nose, chin, occipital and temporal areas of the head. Bandages with the use mesh tubular material. Area of use: almost every area of the body. Adhesive plaster bandages are used on different parts of the body. They are easily and quickly applied, do not restrict the movements of the patient and are economically. They are subdivided into adhesive plaster and clean column labeled rules of bandaging. Before applying the bandage, it is important that the patient assumes a comfortable position and that the area to be bandaged is of easy access. The bandage is applied with a limb in functional position, especially in cases of long-term care. During bandaging, the person who is applying the bandage is to be facing the patient in order to look after the patient's status. The applying of the bandage should start from peripheral/parts. Little by little, covering with the bandage turns towards the central parts of the body. The exceptions are bandages on the hand and feet. Bandaging is started with 2-3 fixing circular turns. The head of the bandage is held with the right hand, the loose end is held with the left one. Direction of the bandage turns is from the left to the right, excepting bandages on the left eye, left mammary gland, and others. The outer aspect of the bandage is laid on the surface of the body to be bandaged. The bandage mustn't form folds or defects. The hand of the one bandaging moves over the surface being bandaged in direct contact with the skin and should not pull the bandage away on air. The hand of the one bandaging has to follow the turn of the bandage. Make sure not to bandage too tightly except pressing bandages so that it won't cut off circulation, and at the same time not too loosely won't slip off the wound. Every following turn should overlap and cover the previous one by 1/2 or 2/3. For fixation after it is applied, the end of the bandage is fixed with the adhesive plaster or it's snipped with scissors in the longitudinal direction. Both ends are crossed and then tied up, with that neither the cross nor the knot are supposed to lay on the wound. Sometimes the end of the bandage is tucked in under the final turn or is fixed with a safety pin. For removal, the bandage is either cut or untied. If cutting off the bandage is necessary to begin the cutting away from the wounded part. In case of untying it, the bandage is untied and wrapped around the hand into a ball, changing it from one hand to the other near to the wound. Requirements for bandaging. The bandage should cover the wounded part of the body firmly. The bandage mustn't block circulation and lymphokinase. The bandage should hold firmly to the skin. The bandage should have a neat and clean appearance. Main types of gauze bandages. Circular or round bandage. It is the beginning of any soft bandage and can also be used all alone independently for covering of small wounds on different parts of the patient's body. This bandage is applied in a way that each following turn completely covers the previous one. Spiral bandage. It is applied to cover big wounds on the trunk and limbs. It begins with circular turns above and below the injury area, and then the turns are applied spirally, overlapping the preceding one by 2/3 the width of the bandage. Creeping bandage is applied for quick and temporary fixation of the bandage material on significant lengths of a limb. The bandage begins with circular turns around the wrist/radiocarpal or ankle/talocrural joint. Then the turns are applied spirally in a way that each successive turn doesn't touch the previous ones. Crosswise or figurative bandage. It is applied on the parts of the body with a regular surface such as the occipital area, the hand or foot. This bandage begins with circular turns. Then they are followed by crisscross turns that alternate with the circular ones, applied proximally and distally to the crisscross turns. Spike-it bandage. It is variation of figure of a bandage and differs from the other with the turns of the bandage being applied upwards or downwards, reminding the shape of a spica. The areas of use of this bandage are the shoulder joint, hip, thumb, inguinal and gluteal areas. Turtle bandage. It is applied on the knee joint and elbow joint areas. There are two types of turtle bandage. See the divergent turtle bandage begins with circular turns, passing directly through the joint area. Then, the following turn is laid above and the other below the first circular ones. The crossing of the turns is then made on the popliteal fossa. On inferior limbs the bandage is ended on the thigh above the patella, and on inferior limbs, on the arm above the styloid process. Convergent turtle bandage is begun with circular turns on the left forearm below the joint area, and then, through the elbow pit, the bandage is carried onto the thigh or the arm, right above the joint. Only circular turns are applied here for the stability of the bandage. Then, circular turns are laid above and under the joint area, crossing over the elbow pit towards the joint. The bandage is fixed on the thigh or the arm just like the divergent turtle bandage. Coming back bandage is applied on the head, for example, Hippocrates cap, as well as on amputation stumps of lower limbs. The bandage is started with circular turns. Then, on the frontal surface of a limb area the bandage is folded and a vertical stripe is passed on towards the posterior surface of a limb and returned to the front. For fixation of the vertical striped, circular turns are laid around the head or a spiral bandage is applied. The vertical stripe is fixed by circular turns or by a spiral bandage. T-form bandage is applied for fixation of dressing material in case of wounds of the perineum, sacral, or coccyx areas. A few circular turns are passed around the waist. It is then called belt in the front or in the back part. Another bandage is attached to the belt with which vertical turns are passed through the perineum alternately, by wrapping it around the belt. The bandage is ended by fixing the loose end of the delta to the belt. Spiral bandages on the head. Circular bandages on the head are applied in case of small wounds on the head, temporal, frontal, occipital and parietal areas. Circular turns are passed through all the above-mentioned areas of the head, above the ear. In order to apply the bandage firmly, it is passed over the superciliary arches. The bandage on the right eye is applied in case of eye injuries. The bandage is started with 2 to 3 circular turns around the head above the ear. Then, on the occipital area, the bandage is obliquely carried down below the right ear. It is returned to the forehead covering the right eye. The eye is closed with a sterile pad. The circular fixing turn is applied around the head and all the turns are repeated. Bandages on the left eye are applied in the same way. The only difference is in the direction of the turns, from the right to the left. Bandage bandage on both eyes is applied in case of injury of both eyes. The beginning of this bandage includes the same turns of the bandage on the right eye. Then the bandage is obliquely carried downwards from the forehead, closing, along with this, the left eye. It rounds the left ear from below and is obliquely carried up over the occipital area. Further, a circular fixing turn is laid around the head and all the turns of the bandage are repeated. Bandage on the ear. Neapolitan cap begins with 2 to 3 circular turns around the head above the ears. Then the turns of the bandage from the injured side are carried lower and lower, covering the areas of the ear and the mastoid process. The bandage is ended with circular turns of the bandage around the head. Cap bandage. It is considered the best and most reliable bandage on the head when it comes to covering the scalp. A 50 to 75 cm long bandage stripe is laid over the head and frontal plane on the tempo-parietal area of the head in such a way that the loose ends of the stripe are hanging vertically over in front of the ear, and it is pulled/stretched down by an assistant. Sometimes it can be done the patient himself. Over the band, 2 to 3 circular turns are passed around the head above the ears. Then when reaching the vertical knot on the right, the bandage is turned around it. That is, a loop is made, and further the bandage stripe is carried over the forehead, overlapping the previous circular turns by half their sizes. When reaching the left knot, again the loop is made and the bandage is obliquely carried onwards over the occipital area, overlapping the previous inferior one by half its size, and so on. Until the scalp is completely covered. The end of the bandage is tied up to the vertical band to any of its side. The loose ends of the vertical stripe are tied up on the chin area for steadiness of the bandage. Bandage Hippocrates cap is also applied for covering the scalp. For this bandage, a two-end bandage is needed. It is prepared/made with two bandages with the same length the following way. In the loose ends of the bandages, a 3/4 cm notch is made. Then, the loose end of the first bandage with the small notch is passed through the hole of the second bandage, and the head of the first bandage is passed through the loose end of the same bandage. Then the head of the bandage is moved apart. The tightening spot of the bandage is laid on the forehead, and the turns of the bandage are carried on towards the occipital area, where the bandages cross. Along with this, the right head of the bandage continues to make circular turns, and the left one, after bending, changes into the sagittal direction, following on to the forehead over the parietal area. On the forehead, where the heads of the bandages meet again, the first head one continues to make horizontal circular turns. Was this fixing the vertical turns of the left head, which returns to the occipital area, where it again crosses the horizontal turns of the right head, and so on. The vertical returning turns gradually cover the scalp up. Thus, with one part of the bandage, turns are made in the antero-posterior direction, and with the other in the circular direction. The bandage is ended with horizontal circular turns around the head. Brittle bandage is applied in case of injury and trauma of the mandible. The bandage begins with 2 to 3 circular turns around the head above the ears. Then the bandage is obliquely carried downwards from the occipital area below the right ear and follows on to under the mandible. Then 2 to 3 vertical turns are applied in the frontal plane. Was this the turns of the bandage fix the mandible from below and pass in front of the ear through the temporoparietal areas of the head. From the chin area, the bandage turns change direction into the horizontal one on the back of the neck. The bandage is continued with circular horizontal turns over the nape, fixing the mandible from the front part. Then, similarly, the bandage stripe is returned to the vertical turns, with which the horizontal turns of the bandage are fixed under the mandible. From under the chin area, the bandage again is carried on towards the nape, passing below the left ear and then going obliquely upwards over the occipital area. It is laid towards the head, where 2 circular horizontal turns are laid above the ears. The bandage is ended. Crosswise bandage on the occipital area is applied in case of injury of the occipital area of the head. The bandage begins with 2 to 3 circular turns around the head, above the ears. Then, behind the left ear, the bandage is obliquely carried downwards over the occipital area, behind the right ear, bypassing the patient's neck from the front and left sides. Next, the bandage is obliquely carried upwards over the occipital area above the right ear. Following that, a circular fixing turn is laid around the head and all the turns are repeated. It is important to note that each following crossing of the bandage on the occipital area overlaps upwards or downwards after the previous one, closing along with this the occipital area. Bandages on the trunk and pelvis. Spiral bandage on the thorax. It is applied in case of thorax trauma. The bandage is applied in such way that it doesn't slip off the thorax, which constantly changes its diameters as a result of breathing. For this, a stripe is used before applying the bandage. This band is laid on the shoulder with its loose ends hanging over the frontal and back sides of the thorax obliquely. The bandage begins with 2 to 3 fixing horizontal turns that pass over the inferior edge of the costal arch. Then, with spiral circular turns, the thorax is covered up to the armpits, where circular fixating turns are made. The loose hanging ends of the band are tied to one another on the right shoulder. Occlusive bandage on the thorax is applied in case of perforating wounds of the thorax in order to provide first aid to injured people, since it prevents the entrance of air into the thorax. For this, individual bandage packets are used. They contain a gauze bandage and two attached to it gauze pads. One pad is fixed to one of the bandage ends and the other can slide over the bandage. The sterile material is rolled in parchment paper and covered from on the outer side by a rubber or cellophane cover. The rubber cover is opened on the cut line and the content is taken out. Then the paper cover is unfolded. The inner side of the cover is used as sealing material and is laid on the wound, the edges of which are previously cleaned with antiseptic solution. With the right hand, take a roll, and with the left, the end of the bandage. The pads are unfolded and laid on the wound with the side wasn't in touch with the hand. The inner side. In case of perforating gunshot wounds, one pad is laid on the entrance hole and the other on the exit one. After what, the pads are bandaged and the end of the bandage is fixed with a pin. The pin comes beneath the external cover of the packet. It is important not to touch the inner side of the pad, which is laid on the wound. The outer side is stitched with a colored thread. In case there is only one entrance hole, the pads are laid on one another or alongside. In cases when there isn't a bandage packet, for sealing any air impervious material can be used, rubber, plastic film and others. A towel or a sheet can be used for bandaging material. The thorax is wrapped up with them and the turns are tied on the healthy side. The wound can be sealed with stripes of sticking plaster, laid in the form of overlapping tail bandage in such way that the edges of the wound are drifted together and the sticking plasters are laid one over the other. bandage on the right mammal gland is applied in case of traumatic injuries of the mammal gland and in case of acute lactation mastitis for pressure in order to stop lactation. The bandage begins with 2 to 3 circular horizontal turns, each passing directly on the mammal gland. Then, the bandage is carried obliquely upwards onto the left shoulder, fixating the gland from its inferior medial edge. Each following turn is carried towards the lateral side, thus covering the whole gland. From the left shoulder, the bandage is obliquely carried downwards along the back to the right armpit area from where it is obliquely laid on the mammal gland, fixating it from the inferior lateral edge. Each following turn passes throughout the armpit, going upwards and towards the medial side. The bandage ends with circular horizontal turns around the thorax on the mammal glands. The bandage on the left mammal gland is applied similarly. The only difference is in the direction of the bandage turns from the right to the left. Bandage on both mammal glands are applied in case of traumatic injuries as well as for ceasing lactation in cases of acute inflammatory diseases of the mammal glands. The bandage begins in the same way as the bandage on the right mammary gland does, with the same turns. After all the bandage turns are applied on the right mammary gland, the bandage is carried over the frontal side of the thorax under the mammary glands and leads obliquely upwards onto the left armpit, fixing the mammary gland from its lateral edge. Each following turn is laid upper the previous one. Then the bandage is obliquely carried upwards over the back onto the area of the right shoulder from where it goes obliquely downwards throughout the medial edge of the left mammary gland. Each following turn is laid upper the previous one. Then the bandage is obliquely carried upwards over the back onto the area of the right shoulder from where it goes obliquely downwards throughout the medial edge of the left mammary gland and leaves in horizontal direction towards the back. Each following turn on the left mammary gland goes to the lateral side, thus covering the whole surface of the mammary gland. Then, all the bandage turns are repeated until both mammary glands are covered. Spiket bandage on the hip joint, inguinal and gluteal areas is applied to cover wounds of those areas. The applying technique of these bandages is the same for all of them. The only difference is in where the crossing of the bandage is made. The bandage begins with 2 circular horizontal turns around the abdomen. Then a figure of 8 turn with crossing of the bandage is made on the area of the wrist. This bandage can be ascending if each following turn is made above the previous one or descending. Bandage. Bandages on the superior limbs. Spiral bandage on one finger of the hand is applied in case of trauma or injuries of any of the fingers of the hand. The bandage begins with 2 to 3 circular turns on the radiocarpal joint level. Then, the bandage is carried obliquely through the back part of the hand onto the distal phalange of thumb, from where it is completely bandaged until its base. Then, the bandage is carried obliquely through the back part of the hand onto the wrist area in such a way that the bandage turns are crossed. The bandage is fixed with circular turns on the radiocarpal joint area. Spiket bandage on the thumb is applied in case of wounds and traumas of the thumb. This bandage begins in the same as the spiral one. Then the bandage is passed over the back surface of the thumb onto its distal phalange, and with a semicircular turn the palm side is covered, forming a crossing on its back surface. Next, the bandage is carried through the back side of the hand onto the wrist, and again the figure of a turn is made, each time being wrapped lower until the base of the thumb. The bandage is fixated with circular turns around the wrist joint area. Bandage on the fingers of the hand or night glove is applied in case of trauma and injuries of the fingers, or in case of bird frostbite of the hand, or when it's necessary to cover all the fingers separately. The beginning of this bandage is the same as of the spiral one. It is important to note that on the left hand, the bandage begins from the little finger, and on the right hand, from the thumb, and each finger is bandaged alternately and separately with spiral bandages. Along with it, all crossings of the bandage are made on the back side of the hand. And if it is necessary to bandage the whole surface of the hand, the bandage on the fingers is continued with spiral or crosswise ones on the hand. The bandage is ended with circular turns around the radiocarpal joint area, crosswise. Crosswise bandage on the hand is applied in case of trauma and injuries of the hand. It begins with 2 circular turns on the radiocarpal joint area. Then, the bandage is carried obliquely through the back side of the hand onto the metatarsophalangeal joint where a circular turn is made. Next the bandage is returned to the wrist, making a crossing on the back side of the hand. In order to the bandage equally covers a hand, figure of 8 bandage turns are made alternately on the back and on the palm sides of the hand. The bandage is finished with circular turns around the radiocarpal joint area. Returning bandage on the hand or mitten is applied in case of extensive burns or frostbites when it is necessary to bandage the whole hand and the fingers. The bandage begins with 2-3 circular turns around the radiocarpal joint. Then on the back side of the hand the bandage is folded 90-degree angle in relation to the circular turns and is carried on towards the bases of the fingers. Next the bandage is returned on towards the wrist but in the palm side of the hand. This way the whole hand is covered with vertical returning turns of the bandage that for its part is fixated with circular turns from the fingertips to the radiocarpal joint area. There are different versions for covering the thumb. It is possible to bandage it onto the wrist or cover it with a spica or spiral bandage, thus reducing the prehensile function of the injured hand. The bandage is ended with circular turns around the radiocarpal joint. Divergent turtle bandage on the elbow joint is applied in case of trauma and injuries of the elbow joint area. This bandage limits somewhat the active movement of the injured joint. The bandage begins with 2-3 circular turns, passing directly on the joint area. Then, one turn is laid above on the arm and another below the first circular turns on the forearm. The crossing of the turns is made on the elbow pit. The bandage is ended with circular turns on the arm, above the elbow joint. Convergent turtle bandage on the elbow joint begins with 2-3 circular turns on the forearm somewhat below the joint. Then, over the elbow pit, the bandage is carried on towards the arm, as above the joint as possible. There a couple of circular turns are wrapped for stability, and then the figure of a bandage turn is laid above and below the joint area, crossing on the elbow pit and moving towards the joint. The bandage is ended with circular turns on the arm, above the elbow joint. Spiket bandage on the shoulder joint is applied in case of trauma and injury of the shoulder joint. The bandage begins with 2-3 circular turns on the arm below the inferior edge of the triangular muscle. Then the bandage is carried over the back side of the thorax throughout the scapular area towards the armpit of the healthy side. Then the bandage is carried over the frontal side of the thorax towards the injured arm, bypasses it from its sides, then is obliquely carried upwards, making a crossing on the lateral side of the arm and follows out onto the back side of the thorax. From here the bandaging is repeated, and with that each new turn is laid a little more above the previous one, forming in the area a crossing in the shape of a spica. The bandage should cover completely the injured shoulder joint and also partially the forearm area. Spiral bandage on the superior limb is applied in case of trauma and injuries of the forearm and the arm. It can be applied with folding and without it. The second one is practical for bandaging of more uniform parts of the body. Regarding the thickness, for example the arm or the thigh, it is begun with 2-3 circular turns on the distal areas of a limb, and then the turns of the bandage are carried spirally upwards, overlapping the previous ones by 2/3. Spiral bandage on the superior limb. Spiral bandage on the superior limb with folding is applied on a limb according to the form of the body area. For example, forearm and leg. After laying 2-3 circular turns around distal parts of a limb, it is bandaged with folding. For that the bandage is carried obliquely upwards and fixed on the inferior edge with the thumb. The bandage is folded in such a way that its superior edge becomes the inferior. Then the bandage is carried obliquely downwards, wraps a limb, and once more repeats the folding. All the folding are made on the healthy side of a limb and following one line. The bandage is ended with circular fixating turns on the proximal end of a limb. Default S bandage is applied for temporary immobilization in cases of fracture of the ulnar, clavicle and scapula. The patient is assisted to sit on the couch. The injured arm is bent at the elbow joint to right angle and firmly pressed against the trunk. A roll made of soft fabric or a rolled bandage is placed onto the armpit. The first bandage turn is carried from the armpit of the healthy side towards the arm of the injured limb, coming around it from the back side. The bandage is carried over the back onto the area of the healthy armpit. With the help of a few circular turns, the injured arm is fixated to trunk. Then the bandage from the armpit area of the healthy limb passes through the front side of the thorax obliquely upwards onto the shoulder of the injured side. From here vertically and downward, over the back side of the arm, it bypasses on the radiocarpal joint area and goes to the armpit of the healthy side. Hence over the back the bandage. It is carried obliquely upwards onto the shoulder of the injured side. These turns are repeated a few times for good fixation of the injured superior limb. To verify if the bandage was applied correctly, it is possible to see two triangles on the front and back of the patient's body that are formed as a result of the characteristic turns of this bandage. Default bandage is applied for temporary immobilization in case of fracture of the clavicle as well as after shoulder dislocation reduction. The patient is assisted to sit on the couch. The injured limb is bent at the elbow joint so that the palm of the hand lies on the healthy shoulder, more exactly on the trapezoidal muscle. First, the injured limb is fixated with circular turns of the bandage in the direction from the injured to the healthy arm. With these turns, the arm and forearm are wrapped around and the bandage is carried from the healthy armpit to the back. From the back the bandage is carried obliquely upwards over it onto the injured forearm and is laid as close to the shoulder joint as possible. Then, it bypasses the forearm from behind forward and is led vertically upwards over the back side of the arm. Then the injured limb is wrapped from below the elbow joint and the bandage is carried on towards the armpit of the healthy side. The bandage turns are repeated a few times until the injured limb is firmly fixated on its entire surface and each vertical turns is legged to the medial side towards the neck and each horizontal one downwards to the elbow joint. Bandages on the inferior limb. Spiral bandage on the first toe of the foot is applied in case of diseases and injuries of the foot toe. This bandage begins with 2 to 3 circular turns on the ankle joint area, then over the back surface of the foot. The bandage is carried onto the distal phalange of the first toe. From here, with spiral turns the toe is covered up until its base and again through the back surface of the foot the bandage returns to the ankle joint, where it is ended with circular fixing turns. Bandage on the whole foot is applied in case of injury and diseases of the foot, for example burn, frostbite, gangrene. The bandage is begun with 2 to 3 circular turns on the ankle joint area. Then the foot is wrapped a few times with the bandage on its lateral surfaces covering the toes and the heel areas. These turns are laid loosely without tension so that the toes won't be bent. Then, beginning from the tips of the toes, the foot is bandaged with spiral turns, finishing the bandage with fixating turns on the ankle joint area. Spiket bandage on the foot is applied in case of injuries and diseases of the foot without injury of the toes, and also in case of trauma of the ankle joint. On the right leg, the bandage is begun from the external surface of the foot, on the left, from the internal. After laying 2 to 3 circular fixating turns on the ankle joint area, alongside the lateral edge of the toes, the bandage is carried until the base of the toes. Over the back of the foot on the metatarsophalangeal area, the bandage is carried onto the internal edge of the foot, and a round turn is made over the palm surface. Then the bandage is again laid over the back surface of the foot, where it obliquely crosses the previous turn. After the crossing, the bandage is carried along the internal edge of the foot and laid as lower as possible, until reaching the heel area, which is rounded from behind, and then a turn like the above mentioned is repeated. Each new turn on the heel area is laid above the previous one, and the crossing is made by carrying it towards the ankle joint. The bandage is ended with circular turns around the ankle joint area. Crosswise bandage on the ankle is applied in case of trauma and ankle sprain. The bandage begins with 2 to 3 circular turns a little above the ankle on the leg. Then the bandage is carried obliquely over the back of the foot, where a circular fixating turn is applied around the foot. Then the bandage is returned onto the leg. The crossing is made on the back surface of the foot. All the following turns are carried towards the epicondyles of the fibula and of the tibia. The bandage is ended with circular turns on the leg where it began. Bandage on the heel area is applied in case of injuries on the heel area. In order to cover the heel area, a divergent turtle bandage is applied. The bandaging begins with circular turns around the heel area. The following turns are laid above and below the first turn. These turns are fixated with an oblique turn from aside the heel, going from behind forwards and changing position to the palm surface and back of the foot. then over the ankle area and downwards on the foot. The crossings are made on the back part of the fold. The bandage is ended with a circular turn around the heel area. Spiral bandage on the inferior limb. Convergent and divergent turtle bandages are applied in the same way as the bandages of the same name on the superior limbs. Kerchief triangular bandages. Kerchief bandages are very easy to provide first aid to injured people. The area of appliance is extensive. Trauma and injuries of the head, mammary gland, thorax, superior and inferior limbs, sacral and perineum areas. They are simple to be applied. Preparing the kerchief is very easy. It can be made of a sheet or a stripe of cloth. The square-shaped fabric with size/dimension of 100x100 large kerchief or 75x75 small kerchief depending on the area the bandage is to be applied on. For that it is necessary to fold the cloth in the half diagonally or cut it in such a way that the isosceles triangle is formed. Kerchief is a piece of cloth of triangular shape in which there are three different parts: the basis, the longest side, the apex, the angle that lies opposite to the base, and loose ends, the last two angles. In case of emergency, the head scarf or bandana can be used, or the bandage can be made out of a shirt or t-shirt. To cover the wound, you are also going to need a sterile gauze, which can be found in any car first aid kit. Now we are going to see the main types of sling bandage for different parts of the patient's body. Kerchief bandage on the head is applied in case of injuries of the scalp. For this bandage, a head scarf, bandana or a small link can be used. In case of wound of the occipital or parietal areas, the kerchief is laid on the head in such way that its apex is directed to the nose. The loose ends of the bandage are tied up together on the forehead, and the apex covers the knobbed area and is fixated with an adhesive plaster or safety pin. In case of wound of the forehead, the kerchief is laid on the head with the apex directed to the occipital area where the fixation of the bandage where it is fixated. Kerchief. Kerchief bandage on the mammary gland is applied in case of injury of the thorax and mammary gland. The sling is laid in the following way. The apex of the kerchief is directed to the armpit area on the injured side. The upper loose end goes through the shoulder on the same side, and the lower loose end through the lateral side of the thorax of the healthy side. On the back, all the ends of the bandage are tied together. Sling bandage. Bandage or immobilization of the superior limbs is applied in case of fracture of limbs, dislocation of the shoulder joint and other injuries of the superior limbs. To apply this bandage, the injured limb is bent at the elbow joint to 90 degrees. The sling is laid under the traumatized arm in such a way that it is directed to the injured side and lays on the level of the medial third of the arm. The superior loose end is led through the healthy shoulder. The inferior loose end rounds the injured arm through the forearm and goes on towards the shoulder from the injury side. The loose ends of the kerchief are tied on the nape, and with the apex of the kerchief the injured arm is wrapped and fixated with the adhesive plaster or a security pin. Kerchief. Kerchief bandage on the hand is applied in case of several injuries of the hand. To apply this bandage, a head scarf, bandana or small kerchief suits. The injured hand is laid on the stretched kerchief with the palm surface down in a way that the fingers of the hand were directed to the apex of the kerchief. With the apex of the kerchief, the back part of the hand is covered, and with the loose ends the hand is wrapped from the lateral surface on the opposite side. The loose ends are tied on the forearm. Kerchief bandage on the foot is applied in case of several injuries on the foot. For this bandage, a big kerchief is necessary. The injury side is laid with the palm surface on the stretched kerchief in such way that the toes of the foot are pointing the apex of the kerchief. With the apex, the back of the foot is covered, and with the loose ends the foot is wrapped from the lateral surface in the opposite direction and go out onto the ankle joint area. The loose ends are tied on the leg. Kerchief bandage on the perineum, gluteal, sacral or inguinal areas is applied in case of injuries of the above-mentioned areas. For this bandage, a large kerchief is necessary in case of big wound of sacral or perineum area. The kerchief is laid on the gluteal area with the apex facing downwards. The loose ends are tied together from the front part on the abdomen, and the apex is led through the perineum area and with those fixated to the formed belt. In case of injury of the inguinal area, the kerchief is laid on the patient's body on the front part, and the loose ends are tied on the lumbar area. Sling bandages. In Desmurgy, sling is a piece of gauze or cloth in the form of stripe of 50-60 cm length, both ends of which are snipped in the longitudinal direction in a way that the 10 to 15 cm diameter middle of it is not cut. In this bandages there are 4 ends, and the middle part is designed for fixation of sterile gauzes on the wound. Sling bandage are mostly used in case of injury of the nose, as well as injury of the chin, occipital and temporal areas, as well as the kerchief bandages doesn't cover the injured area completely. The kerchief can be made of a white gauze bandage or cloth. Was this the length of the bandage is selected individually for each patient. A necessary condition for the kerchief bandage is the crossing of the inferior and superior ends before tying them up. Sling bandage on the nose is applied in case of nose injury. The wound is covered with a sterile gauze and the bandage striped of the needed length is measured with which the sling is made. The sling is laid on the injured area. The inferior ends of the bandage are carried above the ears or obliquely up and are tied on the occipital area above the external occipital protuberance. The superior ends of the bandage are passed below the ear and tied on the nape. Sling bandage. Sling bandage on the chin area is applied in case of injury of the chin area as well as fractures of a mandible. The wound is covered with a sterile gauze, then a sling of the necessary size is made. The bandage is laid on the injured area. The inferior ends of the bandage are carried obliquely upwards in front of the ears and are tied up on the parietal area. The superior ends of the sling area carried below the ears and are tied up on the back surface of the neck. For additional fixation, the circular bandage is laid around the head. Sling. Sling on the occipital area is used in case of injuries of the occipital area. The wound is covered with a sterile gauze. The sling of the necessary size is made. The bandage is laid on the injured area. Then the superior ends of the sling are led obliquely downwards in front of the ears and are tied up together below the chin area. The inferior sling ends are carried obliquely upwards in front of the ears and are tied up together on the forehead. Sling on the parietal area is applied in case of injuries of the head on the parietal area. The wound is covered with a sterile gauze, then a sling of the needed size is made. The sling is laid on the injured area. The superior ends of the slings are carried obliquely downwards in front of the ears and are tied up together on the chin area. The inferior ends of the kerchief are led obliquely downwards behind the ears and are tied up together below the occipital process. Bandages with the use of elastic mesh. Tubular bandages. Elastic mesh tubular bandages are applied for fixation of sterile bandaging material on different part of the patient's body. According to the size, there are 6 types of elastic mesh. Tubular applied on the fingers of the hand, applied on the hand, forearm, foot, elbow and radiocarpal joints applied on the arm, ankle and knee joints, and 5 applied on the knee joint, thigh and head, applied on the thorax, abdomen areas and pelvis. stick plaster bandages are frequently used. In case of small wounds, bactericide stick plasters are applied. They contain a gauze or cloth pad imbibed with antiseptics. Generally, the stick plasters of cloth material are used for fixation of sterile bandaging material. Areas of use: practically any part of the body, with exception of the scalp. In case of hypersensitivity of the patient's skin to the common adhesive plaster, and for prophylaxis purposes of allergic reactions as well, hypoallergenic stick plasters made with paper or cloth material is used. Cleolum labeled bandages. Nowadays, for adhesive bandaging, cleolum is used, which does not constrict and does not irritate the skin. Composition: colophony, 40 parts alcohol, 33 parts ether, 15 parts sunflower oil, 1 part. The technique of applying this bandage is the following. The sterile gauze is placed on the wound, and cleolum is applied to the surrounding skin with a gauze ball. In 30 to 40 minutes, when the glue begins to dry, a gauze with required form and size is applied firmly onto the skin and stretching the edges. The edges of the gauze that didn't adhere to the skin are cut off. After removing the bandage, cleolum is easily removed from the skin with the help of ethyl alcohol. Compression bandages. These bandages area applied specially to stop all types of bleeding, capillary, venous and arterial. The application of compression bandages on the area of a bleeding wound causes the increase of intratissue pressure and pressure in the traumatized vessel diameter. This contributes intravascular clot formation. A well-applied compression bandage is capable of stopping bleeding even from great vessels and in anatomically complex areas. The technique of appliance of compression bandages is: first, it is important to be sure if there isn't any foreign body on the wound, glass, wood or metal splinter. Free the wound area of clothes and lift the injured limb above the heart level, with the patient laying down. After that, a few sterile gauzes are applied onto the wound, and in case there isn't a gauze, then a pad made of clean fabric, for example, a handkerchief, a piece of sheet, parts of clothes and others, and is tightly pressed to the edges of the wounds as they are simultaneously being brought together as close as possible over the sterile gauze. To increase the pressure, a few more gauzes or pad from folded fabric is laid and then it is wrapped tightly. This increases the level of pressure on the tissue in 4 times. Areas of appliance: any bleeding trauma, especially wounds of the limbs. Advantages: is it the most sparing and very sufficiently enough effective way method to stop bleeding. Disadvantages of compressing bandages: it doesn't always provide stoppage of bleeding of wounds of great vessels. The pressure causes interruption of circulation to peripheral parts of the limbs. Compressive bandages are indicated in cases of diseases of inferior limbs, veins. The only contraindication to compression bandages is chronic arterial diseases of the extremities. Compressive treatment, as well as for prophylaxis of thromboembolic complications during surgical intervention. Elastic bandages are most frequently used bandaging technique. The bandage is started with a circular fixating turn around the ankle joint area. Then the bandage is led back onto the foot where a circular turn is applied on the projection of the metatarsophalangeal joint of the finger. Next, the foot is bandaged with circular turns and the heel area is covered in the shape of a small hammock. The bandage is continued with spiral turns around the leg. Along with that, after 3 to 4 spiral turns are applied, the bandage is laid back by applying figure-of-8 bandage turns for fixation. Thus a firm multi-layer bandage is formed. It is important to have in mind that the maximal tension is generated on the ankle area, and as the bandage is carried on to be applied proximally, the tension is reduced, giving the patient the impression of wearing tight knee-high boots. The bandage is ended a little below the knee joint by fixating the bandage with a special hook or clip. Along with elastic bandages, special medical hosiery and compression stocking are used. They are made with special medical knitting machines that use seamless technology. Depending on the level of compression and purpose of use, they can be divided into therapy and prophylaxis stocking. For therapy, the knitted compression stockings are selected by the physician given the character and localization of the condition as well as the size of a limb. They are easily applied with the help of Butler's special device.